Okay, this video is to elaborate some points in the diabetic foot ulcer management. You all know how bad is the diabetic foot ulcer, okay? As a result of neuropathy and the ischemia, micro and middle arteries or microangiopathy, okay? Patient will have pain. Sometimes at the end he will not have pain, okay? Numbness, deformity, ulcers, and gangrene, as you all know. First of all, we have four essential points for preventing of diabetic foot ulcer. Okay, the patient should be well educated about his case. Okay, you have to protect sugaries, you have to control his blood sugar, the medication, the protective footwear, and foot, skin, and internal care. Okay, we have actually four important things to prevent or to treat the acute case of diabetic foot or the diabetic foot management. First of all, you have to manage the blood sugar of the patient, okay, and you can do that uh, basing on the sliding scale, okay, the sliding scale of the blood sugar. And then you have to uh, take care of the wound, the local wound care. So the management of diabetic foot is systematic and the local care of the wound. The systematic things to do is to control blood sugar, as I told you. The local things is to take care of the wound, to prevent infection, offloading, and the surgical debridement of the patient, of the foot of the patient. The growth factors may be also given, okay? So manage the blood sugar and take care of the wound by debridement of the wound, okay, flaring, surgical debridement, and so on. Okay, the third thing is to assess the vascularity of the foot of the patient, okay, to see if it is well vascularized or no, to check the pulses of the patient and so on. And based on that, you can give some growth factors that may help in the vasculature, okay, that may assist the vascularity of the foot to accelerate to the healing process of the diabetic foot, okay. And finally, we have the antibiotics, okay, prevention of the infection and treatment of the current infection is the antibiotics, which actually is the least important of these all and the debatable, okay. So it can be a local antibiotic and it can be systemic based on the case. Most of the cases we use the penicillin and the cephalosporin, okay, penicillin and cephalosporin. So 4 points to treat the diabetic foot: control blood sugar, the basal wound care, debridement of the surgery, and so on, the assessment of the vascularity of the patient, okay, and then antibiotics. This is briefly how to deal with a patient with diabetic foot. Actually, this topic has too many details: what type of dressing use, how to debride the patient foot, antibiotics specific usage, how to use it and when, the ways of using it, okay, how to control the blood sugar of the patient, how to take care of the wound, okay. These things are too much details. Now this video is to elaborate the outlines of how to treat the diabetic foot. Thank you very much for watching this video. See you in another video.